Um, okay, good evening, everyone. Before we start, I would just love to announce to you all that the only thing you're allowed to do is either you to react, and when it's time for you to ask questions, I'll let you know when to drop your questions on comment box. So the messages will not get bulky. You don't have to send messages there until you're asked to do so. Don't raise up your hand until you're asked to do so. And the only way you can show that you're following this webinar is if you react to it. Thank you very much. So we already got track of the number of people that have dropped their number and network. And before the webinar ends, you'll receive your airtime or data. So thank you for joining this webinar and good evening. My name is Yaya Kairat, popularly known as Small Simi, the president of Livestock Forum, a 300-level microbiology student, Faculty of Science, University of Abuja. And this is me welcoming you to this webinar. I'll be your moderator for today. I would love to introduce Dr. Amaka. She's the product lead and in-house medical doctor at BetaCare. She's a practicing general practitioner and visionary productive lead. She bridges frontline medical experience with digital innovation, using real-world patient needs into practice features that power better care growth. So she'll be introducing you to BetaCare, what BetaCare is all about, and all you should know about BetaCare. So over to you, Dr. Amaka.
Hi, everyone. Welcome once again to our webinar. I'm so glad to see you. I know you have probably seen my messages around and you've seen a couple things around. I just want to welcome everybody once more to this webinar. Before we dive into this session for today, I would just like to set the stage a bit with just a quick question. Have you ever felt sick, maybe stressed, confused about your health? If you have felt this thing, you can just leave an emoji, maybe a thumbs up or something, so I know you are following me. Just leave a thumbs up if you have ever felt confused, stressed about your health, and you do not know who to call or where to go to. So this is where telemedicine comes in. So I know we've heard about telemedicine a lot, and we might not know what the meaning of telemedicine is. So telemedicine is just a fancy word for healthcare. So without the hospital wahala, healthcare brought to your doorstep. It means you can get to talk to a doctor, you can get your diagnosis, you can get treated, you can get monitored, all from the comfort of your bed, from your home, from your phones. So let me talk more about BetaCare because we are trying to set a difference, right? So we're a virtual hospital, right, that we're trying to focus on sexual reproductive health and mental health issues, mostly in young people. Why we created this platform is because we believe that going to the hospital for this kind of patients can be sometimes embarrassing. So people might feel like they might get judgment or even be recognized by a staff member in the hospital, or they might maybe see one of their aunties somewhere that will give them side eyes and tell them, I'm just imagining, what did this person come to the hospital for, you know? So this is why BetaCare is here. No judgment, no pressure. We just want to give you care that works. So what can you do at BetaCare? We have several things that we have available for you. You can actually talk to a doctor. That's what we call the virtual consultation. So imagine you wake up in the morning, you have a sore throat or you have a pounding headache and you have lectures in the next 2 hours. You don't know what to do. So you just hop on BetaCare and talk to the doctor, and you can just speak to the doctor in minutes. It could be malaria. It could just be stress. You get your answers, no guesses, no Google, no ChatGPT. So you can also book an appointment. Say you don't have time now, but you rather like to book an appointment with a specialist, talk to them maybe at a more convenient time. You can get to speak to our sexual health expert that you would hear from on this call as well, and get them answer all the questions that you need. We also run lab tests, right? So from the comfort of your home, imagine you're sitting down in your house and you're like, I need to go and run this test, but I'm shy. I don't want to go to the lab. They will start asking you questions. You can actually just send a message to us, and we have this lab scientists come to your doorstep to run this test for you We're partnered with very popular labs like SynLab, Ecolab, Health Tracker. They will come to your doorstep and get this test run for you. We also have a pharmacy as well. We have 2 pharmacies located in Lagos, but aside that, we have a network of pharmacies around Nigeria. So no matter where you are, we can get those drugs delivered to you. Say you want to order some antibiotics, you don't want to go to the pharmacy and tell them, I need this antibiotics, because they will just give you one side eye. Come on our platform and we'll get you those pharmacies, those drugs as well. Aside that, we believe in empowering people. So we believe in actually letting people learn by themselves. So we've created a platform as well that allows you to read about these health articles, health issues, topics that are very frequent, like STIs, yeast infections, several different things. They are present on our platform. You can read more about that. So how does it work? At the end of this call, we're actually going to give a brief overview of how it really works. But I will just give you some snippets. You just have to go on our platform, betacare.ng, register, get your mail verified, then log in on your dashboard, and you can do everything I have mentioned here for you. So thank you very much. You don't have to manage all these strange symptoms. You don't have to manage missed periods, burnout, and you're scared. You don't have to rely on Twitter, ChatGPT, Google. You just have to come to BetaCare. We have the right people here to answer you, and we will give you the best care. So, Kyra, I'll be handing over to you to take over. Thank you very much, guys.
Thank you very much, Dr. Amaka. It's actually a nice thing to see that people can get treated even from the comfort of their home. It's a very beautiful thing to see that from the comfort of your house, you can run tests, you can get treated, you can get free consultations even without leaving your house. So now we'll be introducing one of our speakers tonight, which is Dr. Ogooluwa. She is going to be taking the first section of this webinar, that is Your Body, Your Choice. Dr. Ogooluwa is a passionate medical doctor, advocate, and educator in the fields of sexual and reproductive health and gender-based violence. For over a decade now, she's been at the forefront of educating young people on topics ranging from menstrual health to HIV preventions, while also leading grassroots campaigns against harmful traditional practices like female genital mutilation. Dr. Ogooluwa is also the founder of 19 Voices, a storytelling social enterprise using art to drive social change. With her blend of medical expertise and activism, she's truly a force for health equity and gender justice in our communities. So guys, join me as I welcome Dr. Ogooluwa, who will be taking us this exciting section of Your Body, Your Choice. Over to you, Dr. Ogooluwa.
Can we hear me? Hello?
Yes.
Yeah,
Okay.
we can hear you, Dr. Ogooluwa.
Excellent.
Yes, ma'am.
Well, thank you very much for that warm welcome.
Sorry, Dr. Ogooluwa. So before she starts, I would love to advise every one of you to have a daughter and a pet, because after this her section, a giveaway for each section. So make sure that you are attentive, make sure that you are following everything we say, because there will be giveaway at the end of each section. Dr. Ogooluwa, you can continue now. You can actually carry on.
Oh, all right. Thank you very much for that. Thank you, everybody. Thank you everyone for joining us this evening. I have to say that the energy here today is unmatched, and I hope we're able to maintain that energy to the very end of today. I want to thank BetaCare as well for this platform for us to have this amazing conversation. Now let's get right into it. Before we start, I want us to, I don't know where we are now, maybe in your room, in a classroom, wherever it is that you are. Imagine you feel a sudden abdominal pain, or you notice an unusual discharge from your genitals, maybe from your vagina or from your penis, or you realize that you've missed your period for 2 months. Now imagine how you would feel in that moment. Let's in the comment section, just one word, how will you feel in that moment? Yes, I like the emoji Rahab is giving us. Yes, you feel very distressed. Now imagine if you had, and thank you Regina for responding. So Precious, thank you. I like the way we're responding. Please, let's bring it. You feel worried. Exactly, worried. So now imagine if you have a fever, right? Imagine if you have a fever and you have a headache. Among these two situations, which of these will you find easier to go to the hospital? What would you do in these two situations? Thank you. You wonder, are you pregnant? You feel uncomfortable. Thank you. So now I want us to hold our thoughts, because at the end of this session, we'll come back to this question. Now let's go to our next slide. All right. So the thing about this thing is that, when I'm very sure we are aware that even as we're growing older, right, we know that any conversation as regards our sexual health, any conversation about as regards our reproductive health, is one that is wrapped in shame and in silence. I don't know how many of us had a sex education from our parents. How many of us, your parents sit down to say, okay, this is what sex is? If you know you had that, you can have a thumbs up. Now imagine how awkward. None. Okay, some people had that. Nope. So a lot of thank you. A lot of people they never had that conversation, because in our Nigerian homes, in our Nigerian classrooms, right, there's a lot of silence. We don't like to talk about it. We don't like to. Everybody feels like, oh, this is not something you should talk about. This is not something you should talk about. But that is what we are going to talk about here today. This is why we want to have this conversation. Let's go to the next slide. Okay, so how many of us know that we have sexual rights? How many of us, you are aware that you have sexual rights? How many of us know that? Right, I see that a lot of us know. Excellent. So I'm here before we start, right? Before we even go ahead to talk about what are things that we experience in our sexual and reproductive health, let's talk about the rights that we have. First, you have rights to autonomy and consent. You have rights to information and education. You have rights to sexual health services. You have rights to privacy and data and dignity, and you have rights to equality and non-discrimination. These are your 5 rights. And do you know one thing about rights? They are non-negotiables. It's just like if you go to the market now, you want to buy something, maybe from one of the markets, men or women, you can argue the price that this thing is 2,000 naira. You say no, it's 1,500. Your rights are not negotiable, right? Understand that your rights are things that belong to you. They are things that you are entitled to without any form of negotiation. Now let's start addressing these rights one by one. Are we still together? Good. So the first right that we have here is right to autonomy and consent. Right to autonomy and consent. Now I want you to know that let's speak autonomy and let's speak consent. Autonomy simply means ownership. That is, you have ownership of your body. You have ownership of every decision you make on your body and about your body. It is your decision to make. I know that we have a lot of conversation online where people are mocking autonomy. They say something like body autonomy una, or something very silly. I'm here to tell you that body autonomy still stands. It is your right. Do not let anyone shame you into thinking that the choices that you make on your body and about your body are not yours to make. They are yours to make free. And then consent. Consent simply means permission. And in this state, if you say sexual consent, there's a way I love to define sexual consent. We have the Fry's model, which is freely given, reversible, informed, enthusiastic, and specific. Now, these 5 things, if any one of them is absent, the sexual consent is rendered null and void. There is no consent in this situation. So now let's have a freely given. That is, if any sexual activity must be done under, you must freely give. It has to be freely given. You don't have to be convinced. You don't have to, if you feel like you have to convince someone, or you feel like you are being convinced, right, to carry out any sexual act, there is no consent involved. Reversible. Sexual consent is reversible. You can actually take back consent. The fact that you consented by 2 p.m. doesn't mean that you cannot take back consent by 2:30 p.m. It is reversible. You can take consent. Consent is not permanent. Consent is informed. Now, any sexual activity that is done under any form of dishonesty, maybe you say, oh, let's use a condom, and then a condom is not used. That is dishonesty, and that renders the consent null and void. Consent has to be enthusiastic. There has to be no maybes. You have to be sure. You have to be what? You have to be sure. You have to, whatever it is that it has to be sure. There has to be no doubt involved, and then it has to be specific, right? The fact that you agree to one sexual activity does not mean that you agree to another sexual activity. So any consent is freely given, reversible, informed, enthusiastic, and specific. So without any of this, any sexual activity that is done without any of this, right, has no consent involved. And what that means is that there is sexual abuse involved. So let's go to the next thing. Your right to information and education. Now, the thing is, before we started here, I asked how many of us had sexual education. Now, I want you to understand that sexual education is actually your rights. It's something that you have rights to. You have rights to not just any form of education, but accurate information. Accurate information. So whenever you are in a situation where you have the opportunity to receive accurate information, please do not be shy to ask. Ask your questions. The next one, can we go to the next? Right to sexual health services. Now, your sexual health services such as contraceptive, STIs, testing and treatment, safe maternal care, all of these things, they are your rights. And what that means is that nobody has the rights to deny you of any of these things under any guise. Maybe as a result of their own personal bias or personal opinion. You have rights to these things. Let's go to the next one. I see that we're saying I'm too fast. I'll try to reduce the pace. Let's go to the next slide, please. Right to privacy and dignity. It's important to know that wherever it is that you make sexual choices, or wherever it is that you give your data, right, in any form or any way, your identity has to be respected and kept private without discrimination and without judgment. Now, our last right to equality and non-discrimination. Now, all of these sexual rights that I have mentioned, right, they apply to everybody, regardless of their gender, regardless of their sexual orientation, regardless of the presence of a disability, regardless of your marital status, regardless of your age, of your race or sexual background. You have rights to all of these rights, free from stigma and exclusion. So I hope we're able to get all of that. I mean, if we're able to get that, please write the thumbs up. Good, excellent. So now let's move to the next session of our conversation today. Let's move to the next slide. Now that we know what our sexual rights are, how do you then talk to? How many of us have had the experience where you go to the doctor to complain about something, and then you come out of the consulting room feeling even more confused? How many of us have had that experience before? I feel like I came here seeking information, and now I'm even more confused. Thank you. We've had a lot of that experience, but that is why we want to explain to you how to talk to the doctor, how to speak to them, because a number of things that we experience is that the doctor doesn't understand what you're explaining, and because the doctor was not present with you at home, they will need a lot of clarity. So we are here to explain to you how to talk to your doctor. Now, before we go on, I need you to know that whatever it is you are going to the doctor for is not the worst thing that they've heard, and it's not the worst thing they will ever hear in their lives. Yes, doctors were trained to hear this thing. So before you even go, Every form of shyness, every form of shame, just drop it at home. Do not have it, because you are here to seek care. Please, let's go back to the previous slide. Now, the first thing you want to say is you have to first of all describe what you feel and what you see. So if you experience something, feel like, oh, I noticed a discharge that smells funny. Explain. Don't just say, I noticed a yellow discharge, a green discharge, and it smells some kind of way. I noticed maybe from my vagina or from my penis, or I have not seen my period in 3 months and I'm very concerned. And also, we need you to be honest, not perfect. When you clearly describe what you feel or what you see, be honest. We don't need you to we don't need to Google or go to ChatGPT. Oh, what is the medical term for this? No. Just be clear and be honest. The next slide. The next thing that you need to know is you can ask questions, right? Please be free to, because one thing a doctor will ask you is, do you understand? If you do not understand, please say no. Don't feel like, oh, you have to say yes because you don't want you. So a lot of us feel like we don't want to say no because we feel like, oh, I may look dumb. No, if you don't understand, say, ask questions. Is this normal? Should I be worried? Can you explain in simpler terms? I don't understand what that means. Please do not be shy to ask questions. It's okay to say, oh, I'm nervous about this, or you feel like you don't have enough privacy. You can mention that. And the thing about telemedicine is that, like Dr. Amaka has mentioned earlier, you have utmost privacy because you don't have to go to a consulting room. That's one beautiful thing about telemedicine. You can ask, okay, can I bring someone I trust next time? This thing I'm experiencing, I saw it with someone experienced this before. I want to know if it's the same thing. You are free to ask questions. The next slide. Now, remember, like I said, doctors are trained to hear everything. There is no need to feel embarrassed. So remember that it is your body, it is your story, and you're allowed to speak up. And there's nobody who can tell your story and who can tell your experience better than you. So that is one thing that I want us to realize. Now let's go. Now we understand our rights. We know how we speak to a doctor. Now let's go to the next thing. Now, STIs. STIs. Now, STI is like the big thing that we talk about a lot in sexual and reproductive health, because a lot of people, when they hear STIs, they're like, hey, this person is promiscuous. Oh my God, you're dirty and all of that. We are here to speak about the facts about STIs. Now, STIs are sexually transmitted infections, and they are usually infections that are passed through sexual contacts, right? STIs can lead to STDs if they are not well treated. They can also spread through blood, through semen, through vaginal fluid during sexual activity. And common examples include chlamydia, gonorrhea, and HIV. We will see other examples. We also have genital herpes, we have hepatitis B, we have HIV, we have HPV, we have syphilis. Now, all of these things are different types of STI. Before we move to the next slide, I want to ask us a question. Do we think that there are other ways through which STIs can be transmitted besides sexual contact? If you think so, say yes. If you don't think so, say no, because that will help us to understand. If you think that it is only through sexual activity that STIs are transmitted, you can respond. Now let's go to the next slide. I need us to put our response in our head, because we'll answer it in the subsequent slides. Now, we have what we call the STI prevention toolkit. Now, if someone is coming to fix something in your house, maybe to fix the pumping machine or to fix your fridge, they will come with a toolkit, right? Now, we are here to equip you with the STI prevention toolkit. Now, before we move on, there are things that there are danger signs of STIs, right? Things like fever, body ache, swollen glands. If you have abnormal, can we go to previous slides, please? Abnormal discharge from your penis or from your vagina. If you have redness or itching, genital sores or blisters, any of these things, right? If you are experiencing them, they are danger signs of STIs. Now let's move on to the next slide. Now, the STI prevention toolkit is what I like to call it the ICC toolkit. We have information, communication, and connection. Now let's start from information. Now, before you can actually have prevention from something, you need to know what you're dealing with. You need to know what is what. Am I correct? I mean, you will not, if you are having if you want to fix your electricity, are you going to call a plumber? No, you will not, because the plumber does not have accurate information about what you want to fix. So the same way for yourself, for you to prevent something, you need to know. Now, how are STIs transmitted? It can be transmitted through vaginal, anal, and oral sex, not just vaginal sex. It can be transmitted through vaginal, not just vaginal sex, through vaginal sex, anal sex, and oral sex. Very important that we know this. Through skin to skin contact, such as herpes and HIV. Through sharing needles or piercing instruments. Through blood transfusion. Now, this is rare because a lot of blood is mostly screened before it's transfused, but it can occur. And also through mother to child during pregnancy, birth, or breastfeeding. Now, this answers our question. So the answer is no. STIs are not only transmitted through sexual contact. They can also be transmitted through other means. The reason we need to know this is that many times we are very quick to judge. We are very quick to pick up on people. Say if someone says, oh, they had an STI, you say, oh no, you are promiscuous. Oh no, you are this, you are that, you are dirty. Now you can say that someone can actually get an STI through mother to child. Someone can get by sharing needles or piercing instruments. So as much as possible, as we have been equipped to this information, I want to trust that there are certain things we will not say anymore. Now, the next slide. Now, what are the risk factors? Unprotected sex, multiple sexual partners, lack of regular STI testing, substance use during sex, because that will impair your judgment, and sexual violence or coercion. Now, I want to point out, when I say sexual violence, the perpetrator of the crime is taking responsibility for this, not the victim. Please, we do not victim blame here. So, unprotected sex, these are risk factors for STIs. The next slide. Now, what are symptoms of? Now, I need us to know that not all STIs have symptoms, because it's very easy for you to say, oh, okay, and the person does not look like they have an STI, so we can have unprotected sex. No. Some STIs have no symptoms, right? And there are things like, you can have symptoms like sores, discharge, burning, urination, rashes, but there are some that you would not see, such as chlamydia, HPV, and early HIV. HIV goes unnoticed for a very long time by a lot of people if they are not tested. So it is important that we know that not all STIs have symptoms. So please get tested. The next slide. So now, prevention is better than cure. There are ways to actually prevent, such as condoms and dental dams. You can actually not just having them, but correct and consistent use, vaccination, testing every 3 to 6 months if you are sexually active. Then for HIV prevention, there is pre-exposure prophylaxis and then post-exposure prophylaxis as well. And then abstinence or mutual monogamy. Now, this is by personal choice. So these are ways to prevent against STI. The next slide. Now, now we've spoken about information. Now, let's go to communication. Now, for someone, it's very important to realize that in a situation where you'll be seeing each other naked, you should actually be saying the truth. You should actually not be shy to communicate effectively. So it is important that there is healthy communication. If you feel uncomfortable about something, please speak up. If you feel like, oh, I am not comfortable with this, please speak up. That's why we spoke about our rights beforehand. Please, you have the right to speak up. Healthy communication is important to prevent. It is key to prevent STI. It helps to build honesty. It helps to talk openly. Oh, please, let's use a condom. I'm not comfortable with not using a condom. Please, I don't like this. I don't want this. Please, do you have STI screening? Have you recently do you have any tests do you have any proof of being tested? All of these things, please ensure that you have healthy communication. Next slide. Connection. Now, before anything else, right, I need us to know that a lot of things that we believe about our bodies, a lot of ways that in which we view our sexual health is not all the time our faults. A lot of these things are passed on to us. How we feel about our bodies. We will hear about maybe how our parents are talking about, oh, there's one girl, she's an ashewo, she's a this. All of these things, they are learned behaviors. They are not normal and appropriate behaviors, they are learned and they can be unlearned. Because all of these things here, you may think that, oh, when you are slut shaming someone, you are just slut shaming them. But indirectly, you are speaking about how you view yourself as well. So as much as possible, before anything else, before any of the things that we've spoken about, you need to have an appropriate view of yourself and of other people as well. So you need to have a reorientation. Why do I feel like slut shaming this person? Why do I feel this way about myself? Right? All of these things, guilt and embarrassment around sexual health, they didn't start today. They are things that were taught to us, and they are things that can be unlearned. Right? I know there are a lot of things, especially in this aspect, right? There are a lot of things that we can talk about, but time will not permit us. You can always, in the future, right, book a personal consultation to have these conversations. Let's move to the next slide. Now, the thing there about shame and guilt, right, is that it is understandable, but it's something that needs to be unlearned. It is one thing to say, oh, I understand why I feel this way, but it is not okay if you remain that way. So if you feel like you need to let go of a lot of shame, ask the right questions, get tested without fear, use protection without hesitation, seek care. Because like I said, if you have a headache, you will not go to a carpenter shop to seek care. You will go to the hospital. So as much as possible, as a form of self-care, whenever it is that you feel you have any questions, please seek professional help. Seek what? Seek professional help. The next slide. Now, body autonomy, we've spoken about it, is wholeness. That's why we started with our rights. Because it is important that you know that some of these things are your rights. They're not things that you negotiate. So understand that body autonomy is wholeness. Your body is not a battlefield. A battlefield has multiple people fighting for borders, fighting for this. Your body is yours. Your body is yours to make decision on and for. The next slide. Now, this is just the connection cycle. This just shows that once you engage in communication with clarity and confidence, once you seek information and recognize that your health matters, not because of someone else, but because of you, you are on the step to having a wholesome and a very healthy sexual health. Now, let's move on to the next slide.
Okay, so, okay, before we move on, this is just to ascertain if you guys are following or not. We'll have a very interactive section, and it will be like a game. You'll be using your emojis to respond. Dr. Ogooluwa will take that part, but it's just you have to actually react to show that you're following. Dr. Ogooluwa, it's fine, you can continue with the.
All right, so let's now move to the facts or fiction. Next slide.
Okay, so what this section does mean is that if you know that a statement is true, you just react to the facts, thumbs up. If you know that the statement is false, is not true, you just react thumbs down as fiction. So if you're talking of if this statement is true, you react up, that's facts. If it's not, you react down, that's fiction. So let's carry on, Dr. Ogooluwa.
All right. So first question is, only promiscuous people get STIs. Is this facts or fiction? Ooh, excellent, excellent. I can see that we're responding. Now, the next slide. This is fiction, as we've clearly said in our previous conversation. Next slide, please. Let's go to our next question. You can get an STI from oral sex. Is this facts or fiction? Okay, now let's find out. This is facts. Next question. I would know if I had one. That is, if you had an STI. Is this facts or fiction? Good. I love how we are responding. This is an excellent audience. Yes, it is fiction because, like we said, some STIs do not have symptoms. Next question. STI means that you are dirty. Is this fact or is this fiction?
See how everybody is actually reacting thumbs down to this.
I like that. Yes,
these are actually the most people that feel like STI is dirty. The moment you hear that someone is having STI, you start stigmatizing that person. Oh, yeah, Ashawo, that's why you have STI. But now it comes to webinar, everybody's thumbs down.
I want to believe that we've all learned. That's why we're reacting this way. We now have knowledge. So yes, this is fiction. Like I said, I want to believe that after this webinar, there are certain things we will no longer be doing. So now, next slide.
So sorry.
So over to you, Harriet.
Yeah, sorry. So before Dr. Ogooluwa continues, I know that most of you might have jotted something down out of the little she has said so far. So start sending in your questions to the chat box. So from what she has said so far, if you have any question, just drop your question in the chat box so that when she's done, we'll select from these questions and we'll answer them. Thank you.
All right. So now let's move on to the last session of today's conversation. Now that we know our rights, now that we know how to speak to the doctor, and then we are fully equipped with our STI prevention toolkit. Now, what are the things that we can do, right, to self-check and to ensure that we are aware, we have some form of self-awareness? We have what we call the breast self-examination. Now, breast self-examination, there are things that we advise, right, to do once every month, 2 to 3 days after your period. Now, if you look at this image, you will see that it shows how to first stand in front of a mirror. Can we still hear me? Okay, yes. So stand in front of a mirror, right, and raise your hand. You can see me. Stand and raise your hand. The first thing that you should do is to check. Look at the skin around your breast. Look at does the skin look different? Is there any parts that looks strange? Look at your nipples. Be sure that, okay, is this how it has always looked? Is this how it should look? Look at it well. Afterwards, you are advised to touch. You're advised to use your fingertips, right? And then you go up and down. Then you go in wedges. Then you then go in circles as well. You are also advised to check your armpits as well. So all of these things, right? You can also check a video or check the internet to see how to do this appropriately. The next check that we have is and this is not only for women, this is for men as well, because men can actually have some form of breast issue, not necessarily breast cancer, but men can also have breast health issues. Next is testicular testing. Now, testicular testing is advised to also be done once in a month. It's advised that you do it in the shower. So it's advised that you wet your hands, right? You soap your hands, right? Same way if you want to do breast examination, you can use a shower gel. Then you pick your testicles. Please, all these things I'm saying, right? There are not things you should be shy with. This is your body. We spoke about body autonomy. So you need to be sure that you're doing all of this. Don't be shy to check your body. So when you check, you are supposed to check one testicle at a time. And then when you do that, you go up you check, you gently roll it, then you go up the spermatic cord. When you feel it, you see what I mean. And what you're checking for any abnormality. If any place feels different, you check if there's any pain, check if there's any lump, any hardness. You can also check the internet to see how to do this appropriately. Next slide. So all of these things that we've said, right, I want us to understand that they are physical aspects, they are emotional aspects. Your emotional health can also affect your physical health. A lot of us, it is not just auto. You cannot just talk. There are lots of emotional things. There are things that affected our current health in the past. So I'm here to say that these things are valid, but it is very important for us to move on from these things, right? It's okay to feel guilt, confusion, or fear, but it's necessary for us to move on from them. Let us learn to give ourselves compassion and give compassion to other people as well. The next slide. So it is important that you build your confidence by practicing conversation in safe spaces, prepare before your appointment, and know that being curious is strength and not weakness. Know your rights. Speak to the doctor with clarity and with confidence, and also be well equipped with your STI prevention toolkit. And remember that your body is yours to make decision on and for. So now let's go back to our first question that we asked. Imagine you have a vaginal discharge, or you feel an abdominal cramp, or a discharge from your penis, or you miss your period. What are the things that you would do now? Are you going to just go to ChatGPT or go to Google, or are you going to seek professional help? Like we said, telemedicine is here for you. There's BetaCare. You can book a consultation with BetaCare, right? So what would you do now? I want to believe that we have learned adequately and that we are going to make better choices. So thank you very much, everyone. You have been an amazing audience. I won't even call this an audience. You have been an amazing conversation platform. We've had a conversation throughout these few minutes. So thank you all. I hope we are going to, apply whatever it is that we've learned in our daily lives. Thank you.
Okay, thank you very much, Dr. Ogooluwa. This was really a very, very impressive presentation. So some of the audience have questions for you, but then this is how it will be. I'll read out 3 questions from the comment box, but I'm giving 2 people opportunity to vocally ask their questions. So now these 2 people, it's going to be the first 2 people to raise up their hands, and they will have the right to ask their questions verbally before I read out the 3 questions that were selected just now. No. Okay, so I think we have okay, let me check. So Sharon will go first, and please, you only unmute your mic when you're asked to do so. So Sharon, please, can you be fast and ask your question? Sharon, are you there? Okay, she's not.
Yes, I'm here. Good evening. Good evening, everyone. Can you hear me?
Yes, ask your question.
Okay. I want to ask, when you're on your period and you're having unbearable pain, I once heard that your period cramps are supposed to be mild and all that, but I usually get very, very painful unbearable period cramps. So I want to know if it's normal, or maybe if I should go and see a doctor for that. Thank you.
Okay. Should we answer them together, or we should answer each of them?
Ma, I think you should answer each of them.
Okay. So first, the simple answer is yes. Your period should not feel like you are about to lose your life. Yeah, you should have some discomfort, right? But once it is becoming unbearable, you should seek help, please. It should not be a situation where you feel so much pain that you cannot do anything for the rest of the day. So yes, you should seek professional help if it is unbearable. If you have tried using maybe over-the-counter pain medication and they are not working for you, please seek professional help. So let's have next question, please.
All right, so we'll be selecting. Okay, let me. Shoma will be the second person that will ask a question. Every other person can put their hands down. So Chema, please go ahead and ask your question. Enoch, please, George.
Good evening, everyone.
Good
Sorry, can
evening.
you repeat?
Yes, we
evening.
can hear. Please, Enoch, drop your hand. That's just the second person for this section. Every other person can drop their hands.
So my question is, there's rather not like a question. There's this time I noticed that I have a lump under my breast.
Okay.
So, but I noticed that the lump isn't a painful one. It's just there, like it has been there. Trust me, it's more than 5 years. It's been there, but it's not a painful one. So I checked online, and they're like, and painful lumps are usually cancer or something like that. But once it's not painful, there's nothing to worry about. But for some reason, there is part of me that still worries because I don't know if it's a cause for alarm or it's just something I'm supposed to overlook. Like it's just under my breast, so I don't know. I need answers.
Okay. Hello. Thank you for your question. I you should actually see a doctor for that. That's one thing. Google will tell you anything. You might just be having a headache and Google will tell you you have 5 days to live. Genuinely. Google is not to be trusted with your health information because it is just generic information that is on the internet. It is not specific to you. Google does not know your data. Google doesn't know, okay, this is your history. Google doesn't know any of that. So whatever it is that you type on Google is just going to give you and anybody can put anything on the internet. I can put anything. I know, okay, I know nothing about bricklaying, about being a bricklayer, and imagine me just putting articles. So anybody can put anything on the internet. So as much as possible, right? Please see a doctor for this lump. I think you should see a doctor, please. It's important.
Thank you, ma'am.
Don't make any assumption. See a doctor.
Thank you, ma'am.
Yes, you're welcome.
Okay, thank you very much, Dr. Ogooluwa. I'll be reading out the first three questions that were selected. So the first one
Okay.
is, my vagina always itch me whenever I use a toilet outside mine. Does this mean I have an infection?
So they are, first of all, right? The next speaker is going to talk a lot about vaginal discharge and itching. So you actually have appropriate response to this. However, hygiene is very important, but I will not directly say because you are you use another toilet, that's why you have an infection. No. To be sure, like we said, to be sure that you have an infection, what should you do? Get tested. So if you want to be sure, oh, do I have an infection? Please get tested. That's the best way to get to know if you have an STI or not. So, yeah, next question.
Okay, so before I read out the next question, in case you want to get a test, you can virtually book BetaCare to get your test done. So the second question is, please, is it true that you can have an infection by dipping your finger in your vagina when washing it? That's the second question.
Okay, it's funny because like the next session is actually going to answer this. So there's something called, I think we should wait to the next session actually so that we don't repeat this, right? There's something called a balance in your vagina, balance in pH, and that's going to be explained. But it is very possible that if you're using soap or if you are it's something called douching, right? In fact, let me not respond to this. This is going to be actually answered in the next session. It is possible, but they are specifics to it. So let's wait to the next session to have this answered. Your question will be answered appropriately.
I had chlamydia and treated it. I want to ask this question. How can I know that I am safe from STI?
Get tested. Get tested. If you believe that you have treated it, get tested and be sure that you are actually out of harm's way. And also as well, STI prevention toolkit. Please carry out and ensure you are adhering to prevention methods. So yes, that's the best way.
All right. So thank you very much, Dr. Ogooluwa. There's a last question, but I'll be the one to answer this question.
Okay.
What are you to do when you have a friend that have maybe STI and your parents are saying you should stay away? So the answer to this is where BetaCare actually comes in. But when you book BetaCare, your privacy is high. Like nobody knows. It's virtual. They just come. You talk to a doctor that don't even know you. You're very safe. Your details are very safe. You're free to talk to that doctor. And when you want to get your test done, you just get somebody to get your sample. Most of these samples, if you can get it yourself, maybe you want to do a swab test, you can actually get it from your vagina yourself and give it out to whosoever is going to do the test. Your results will be sent to you virtually, and even treatment as well. That's why BetaCare is here. So if she's scared of telling her parents, your parents are telling you to stay away, just book with BetaCare and have a one-on-one consultation with any of the doctors, get tested, and you get treated even without your parents knowing. So, and now, since we've actually asked Dr. Ogooluwa questions and she has answered, it's time for Dr. Ogooluwa to also ask her questions. And the first, this is like fast finger. That was why I told you to all jot down as and listen attentively. The first 3 people that get this question correct will actually have a package. So the first 2 people that get her question should be asking should be asking 4 questions. Yes. The hold on, sorry. She'll be asking 4 questions. The first 3 people that get her question correctly will have a free consultation, free one-on-one consultation with any of the BetaCare doctors. And the last person to answer the 4th question, we get a free lab test bundle. That is, if you answer her 4th question correctly, you have a free lab test. You don't have to pay for it. It's free, just like the name implies. So Dr. Ogooluwa will be asking her questions. If you know the answer, drop it at the chat box, and it's just like a fast finger something. The first 4 people to get the answer correctly are our winners, and someone will reach out to you. A representative from BetaCare will reach out to you, and you get your gift. So if you get it correctly, I'm coming. If you get it correctly, I think just as you're dropping your answers, drop it alongside your WhatsApp number. Yes, I think that's better. So the first 4 people that will be selected, your number is already in your answer. So someone will reach out to you and you get your package. Thank you very much. Over to you, Dr. Ogooluwa.
All right. So our first question is, what is the Fry's method of defining consent? The Fry's method of defining consent. Okay. All right, we already have a response. So now let's go to the next question. You should, like you said, put your WhatsApp number.
Maxi, please drop your number. You got the first question.
The second question is, what are your 5 sexual rights? What are your sexual rights? Basically, what are your sexual rights? You have to write all of them, actually.
Yes, write the 5 in full and add your phone number. Immediately you've written the answer, just add your phone number to your answer so that it will be easy for any of the representatives to reach out to you with your gifts.
Okay. Excellent. We already have a winner. So the next question is, give 3 danger signs.
I'm sorry. So the winner for this second question is Abdurrahman Francis. I think so, yes. We already have a winner for this second question. So just pay attentively to the 3rd question and make sure you answer very fast.
Okay, so give 3 danger signs of STIs? 3 danger signs of STIs. Okay, I think we already have a response. Our last question, like she said, is going to win free testing. Okay.
The winner of this 3rd question is, Bello Fatia Ayomide. So, yes.
So the last question is, how often should you get tested for STIs as someone who is sexually active? How often should you get tested?
Sorry, please. This the third question, it's not Bello Fetia Ayomide, it's Sharon that got the answer first.
Okay, so I think we already have an answer, a winner for the last question. Thank you all for having me. I had an amazing time conversing with us. Enjoy the rest of the session.
Okay. Um, Thank you very much, Dr. Ogooluwa, and congratulations to every one of you that won for this section. This is okay. So for this next section to be okay. Sorry, Dr. Ogooluwa, who was the person that won the last question?
I'm the first person to 3 to 6. The answer is 3 to 6 months, right? So the first person to
That's
give that.
better. Okay, that's better. Yes. Okay. Please, Judith, turn off your mic. Thank you. Okay, so that's it for this section, and every one of you should concentrate for this next section so that you win from the giveaway that comes with that as well. So now, we'll be introducing Dr. Taiwo for the second section. Dr. Taiwo will be talking about the main reason why we're here today, that's reproductive health conversations. And Dr. Taiwo is a medical doctor and public health practitioner with deep experience in SRH and infectious diseases. He currently serves as the clinical lead at the International Center for Advocacy on Right to Health, where he leads critical programs around HIV care, STI preventions, and more. He's also been at the forefront of major health campaigns, including the Canada Africa Mpox project. And we are proud to say that he's now part of the BetaCare specialist team. That is one of the doctors. Today, he is here to speak directly and openly about the things we usually don't talk about. Most of these things that we are shy and everybody is so ashamed of talking about, from discharge and itching to hygiene myths and real solution. So please pay attentively to this particular section. It will answer most of the questions you ask Dr. Ogooluwa. So help me welcome Dr. Taiwo. Dr. Taiwo, over to you.
Thank you, Karat. Can you guys hear me and see me?
Yes, we can. We can.
Yes. Oh, thank you for that wonderful and warm welcome. I'm grateful. And thank you to Dr. Ogooluwa for such a wonderful presentation. And thank you for showing us and intimating us on how to, how to approach your health. Your health is your right and your responsibility. How to talk to your doctor and how to communicate your concerns to us. So this webinar has been a long time in the making. There's been a lot of work that has gone on in the background. We did a survey to ask you guys about the common problems that you have, the common problems that you have, the issues that you're dealing with, and that you don't have the, you don't have the confidence or the confidence to talk about it with anybody. You understand? And these are things that you might think is general knowledge, but it's not. A lot of people don't know too a lot about all these things, and people have to quote suffering in silence all this while. So we're just going to get right to it because we don't have a lot of time. So I'm just going to be making a couple of statements and just put a thumbs up if you've ever done it and a thumbs down if you've never done it. But I'm sure that unless we want to lie, we've done most of these things. A lot of us have done most of these things. So the first one is, have you ever Googled why does it smell down there?
Okay,
Why does
so
it smell
sorry,
weird down there?
Dr. Taiwo. Sorry. So because we don't have much time, if you know any of these things that is showing on your screen, anyone you've done before, you can just drop it at the chat box or you react to it. Make sure that this next session is very interactive because it's actually very, very, very entertaining. Thank you.
Okay, so have you done any of these things? Have you thought your period was too weird to talk about? Have you seen a bump in your genital area and you were wondering what growth is this in my genital area? Have you been too embarrassed to talk to a doctor about anything? Okay, I can see thumbs up, thumbs down. Okay, so let's go to the next slide. So we are just going to be talking about some of these things, the common SRE symptoms that we have, the odor, the itching, the discharge, and the burns. We just want to let you understand when it's a mild concern, when you need to come and see a doctor, when you need to come and see us, when it's urgent for you to do something about it. So let's go to the next slide. So the first one, we're going to be talking about yeast and foul odor. That's as it concerns women. So yeast infection is caused by a fungi. The name of the fungi
And
is candida.
okay, so
The name
please
of the fungi
pay
is
attention to this one, because most times you guys always feel like it's the ladies that always have yeast. If you're a guy here, shine your ear. It's not only ladies that have yeast infection. Thank you, Dr.
yeah,
Taiwo.
yeah, thank you. So this infection is caused by a fungi called candida, and usually the common symptoms is white discharge, itching, white discharge and itching. So if you have some whitish discharge, just mild whitish discharge with mild itching, especially after your period or after you used antibiotics, because if you use antibiotics, it can kill some of the good bacteria in your genital area, and then this yeast can now grow. And so if you have that, is you should be concerned, but it usually clears after some time. But if it now lasts for a longer period, let's say more than a week or a couple of days, then you should definitely come and see us. And if the discharge changes color, maybe it's now yellowish or greenish or even brownish, and there's agitated foul smelling odor, then you should see a doctor. If there's maybe any swelling down there, any bleeding, or you now start having fever with these symptoms, then you should see a doctor. You can have mild odor after you do a workout, any rigorous activity during your period, or if you wear tight clothes. But if you start having like fishy smelling discharge, you know, you should see a doctor. And if that fish smelling that lasts a longer period too, you should see a doctor. If that foul smelling discharge is associated with maybe painful urination or pain or abdominal pain, or if you see blood in the discharge, it might be sign of a sexually transmitted infection, and you should reach out to us, and then we'll help you with it. Also, bleeding, I already mentioned that. So let's go to the next slide. So there's a common misconception. Men have yeast infection too. It's not just for women. A lot of the time, some of those things that the small itching that you have that just clears after some time, it is yeast infection. But it's not something that is peculiar to only women. And some of the symptoms are like similar. So itching, uh, uh, mild redness and itching. Although men don't usually have discharge with yeast infection. But if you it can clear after some time. But if the itching persists, maybe you are itching for like more than a week, then it might not be yeast infection, it might be something else. It might also be the yeast infection, and you need to reach out to us. Let's help you deal with that. If there is agitated painful urination, any swelling, if there's pain, ulcers, or you have like any growth around there, then it might be a sign of a sexually transmitted infection, and you need to reach out. So, foul odor too. Yes, if there's poor hygiene, maybe you're not changing your boxers, or maybe you did a rigorous workout, you sweated, you can have some, you can have some odor. But if the odor does not go away after you've taken your bath, or maybe you are now seeing discharge coming out of your penis, then it might be sign of a bigger underlying issue, and you should reach out. You should reach out to us. Penile discharge, if discharge coming out from your penis, then it might be maybe you have a sexually transmitted infection. It might be chlamydia, it might be gonorrhea, and you should reach out so you should get tested and get treated. If you have ulcers, too, maybe you have like open wound around your genital area or bleeding or pulse or pain, then you should get checked immediately. Let's go to the next slide. So, like I said, you can have mild itching, probably after you use a new cosmetic product, after new soap, pad, or underwear. But if the itching is taking too long to clear, and you've been itching for some days, or the itching is now still with pain, then it might be something else. It might be an STI, it might be scabies, it might be an allergic reaction. But if that itching now is now as there with like ulcers or sores or some swelling, then it's an urgent issue and you should reach out. If you have some growths around your pubic or genital area, like if you shave against the grain. So shaving against the grain means like you are shaving against the direction of your hair growth. So if you shave, you're supposed to shave with the grain. So if you shave against the grain, you might have these shaving bumps. I'm sure almost everyone here has had shaving bumps before. So you can have, yeah, people are even saying thumbs up. Almost everyone here has had shaving bumps before. But if these bumps is not lasting for some time, lasting more than a couple of weeks and it's changing shape, then you should reach out to us. You should definitely reach out to us. But if you have some other growth, if the growth is painful, or if the growth has a cauliflower-like shape, or cauliflower-like appearance, then that might be due to genital warts caused by HPV, just like Dr. Ogooluwa talked about. HPV is a sexually transmitted infection that causes genital warts and some other things. And if you have like a cauliflower-shaped growth around your pubic area and your genital area, then you should reach out and we'll get tested. Let's examine that. If you have, like I said before, painful growths and all, yeah, let's go to the next slide.
Okay, so just like we had this game section during Dr. Ogooluwa, we'll also have the same section with Dr. Taiwo. And this section, um, just leave the emojis that are there. If you've done any of those things, just thumbs up. If you've not done it before, thumbs down. So we'll be working with thumbs up and thumbs down. Just leave these
Yeah.
other two emojis, yes. So if you know you've done any of it, why Dr. Taiwo is reading it out, if you know you've done any of it, just thumbs up. If you know you've never done it, you thumbs down. Thank you.
So if you've ever doused or used vaginal washes, if you've used scented sprays or wipes for your genital area, if you've worn tight clothing without wearing underwear, that's what they call going commando. If you go out without wearing underwear, if you shave against the grain, just like what I said earlier, if you don't change your pads or tampons often enough, you're supposed to change them every 4 to 6 hours. So if you allow it to last longer than that, you can
Hmm.
other thumbs up.
You know, Abuja students are thumbsing down. As if you used to change your pad if you go for classes.
Okay, yeah, I can see that people are reacting.
Sorry, Dr. Taiwo. Okay, so before
Okay,
he continues, just like we did during Dr. Ogooluwa's section, if you know you have questions, start sending in your questions so that by the time he finished, we would have selected question and we will answer. Thank you.
okay. So we're just going to be talking about just tips for vaginal care and just telling you about some misconceptions. So the first one is vaginal douching. You are not supposed to do vaginal douching, either with water or any of these feminine washes that they use for vaginal douching. Why? Because it can unbalance the pH. That's like it can unbalance the pH. pH is a measure of acidity. So there is pH is a measure of acidity. So there's a specific pH that your vagina is supposed to have. And if you now do that douching, it can like affect that balance, and then yeast infection can happen. You can also have bacterial vaginosis. That's a bacterial infection from douching too. So no douching. So the second one is wearing breathable fabrics like cotton. yes, you're supposed to wear breathable fabrics that will allow for ventilation per se. So you're not supposed to use material like nylon now for underwear because if you use it, there's no ventilation. There can be buildup of moisture, and yeast infection likes water, it likes moisture. So you shouldn't do that. So you should wash with plain water or mild soap externally. So one thing is the vagina cleans itself. You don't have to doubt, you don't have to use all these feminine washes. I know that most of you will not believe, but the vagina cleans itself. Just wash with water, plain water, or mild soap, not scented soap, not all this soap that bleach or all these extra things. Just wash it plain water, clear water, and soap externally, and you are good to go. So let's go to the next slide. So that the boys will not feel left out. Let's not be like we're focusing on women. So this is just a couple of things on penile hygiene. For those of us that are not circumcised, when you want to wash down there, you're supposed to peel off, like pull back the foreskin and to wash. Just use mild soap too and water. You don't need to use anything extra because if you don't, because of that foreskin, things can like dirt can get under and it can cause infections too. So that's that. And also breathable fabrics like cotton. Yes, just use like breathable fabrics for ventilation so that you can avoid buildup of moisture. And you are supposed to change your boxers daily. I know that a large number of students don't change their boxers daily, but that's the standard. You're supposed to change your boxers daily. So let's go to the next slide. People are laughing. So, this is just a couple of things on menstrual hygiene. So, like I said earlier, you should change your pad or tampons every 4 to 6 hours. You should change your pad or tampons every 4 to 6 hours. And if you use menstrual cups, they need proper cleaning. Clean with water and mild soap. Don't use anything like oil or any other products to clean your menstrual cups. So let's go. Let's move on.
Okay, so
So,
this next one is also like a game, just like a game. You can also react thumbs up if it's okay. What busted means is like no, false, and trusted means true, yes. So if it is trusted, that is true, you thumbs up. If it is busted, that is false, you thumbs down. Or you can as well as write it in the chat box, which might even take time. So just thumbs up or thumbs down. So if you know it's trusted, thumbs up. If it's busted, thumbs down. Dr.
okay.
Taiwo,
Yeah, the first one is you can catch infection from toilet seats. Do you think you can catch an infection from toilet seat? Okay, I'm seeing a lot of trusted. Nobody's speaking busted. Okay, trusted. Okay, should we answer? I think you should answer that now. We have enough reactions to move on. It is busted. You cannot catch genital infection from toilet seat. I know that there's this common misconception of toilet infection. I have toilet infection, you have toilet infection, you have toilet infection. Even before I became a doctor, I actually believed that. Let me not lie. There was one, I believed that too. But there's no such thing as toilet infection because the organisms, the bacteria, the parasites, and the viruses that cause these infections cannot survive on the toilet seat. So it's always something else. It can be an STI, it can be yeast infection, it can be due to hygiene, but it's not from the toilet seat. No, there's no such thing as toilet infection. Let's know that for from today, there's no such thing as toilet infection. So let's go to the second one.
um,
So period blood is dirty.
okay, okay.
Okay, okay, busted. I think
Um,
we gave
okay.
them expo before that one. Okay, some trusted. Okay, let's answer that. It is busted. Period blood is not dirty. Period blood is just the normal body fluid that comes out of your body. Um, is busted. Period blood is not dirty. Okay, so let's move to the next one. Every itching down there means you have an STI. So do you think it's trusted or do you think it's busted? So we have been listening. So people are answering this one. Busted, busted, busted. Okay, so it's busted. It's busted. There are so many causes of itching, genital itching. There are several causes. It might even be an allergic reaction. It might be due to the new clothing or underwear. It might be due to several things. It might be due to anything, but it's not usually or mostly an STI that causes itching down there. It might be a yeast infection, like we earlier said. So the last one, only women can have yeast infections. Busted. You people have been listening. Okay. So yeah, I think you're all of us. We already know that it is busted. No, men can have yeast infection, and it's actually very more common than you think. Men can have yeast infections. Yeah. So let's move on to the next slide. So these are just some closing tips that we have for you. There's no such thing as a weird question about your body. Feel free to talk to your doctor. Feel free to tell them anything. Feel free to ask. You understand? There is no judgment. When you come to us to book a session and you want to talk about the issues that you have, we are not going to judge you. We are going to approach it in a professional manner, and we are going to help you. If it smells, itches, bleeds too much, or won't go away, see a healthcare provider. I already said that. This might be signs of an underlying issue that you should probably deal with. Your hygiene habits should be simple, gentle, and consistent. Yes, there's no need to do extra, no doubting, feminine washes and all that. It should be the way we've described. You deserve respect and answers when talking to any doctor or partner. Yes, you like it's your right. Like Dr. Ogooluwa earlier said, this is your right. You deserve respect and you deserve answers when talking to a doctor about your issues. Okay, so let's go to the next slide.
Um, okay. Thank you very much, Dr. Taiwo. Thank you so much. Okay, so just like um we've actually selected from few questions that people asked. And just like we did during Dr. Ogooluwa's section, I'll be giving two people opportunity to vocally ask their questions, and two will be selected. Just two. The remaining three will read it out. Okay, the first person is Abida. Yes. So please, can you ask your question? Abida, please ask your question so Dr. Taiwo can answer. Okay, if she's not here, then Abigail, please go on and ask your question.
Um, good evening, everybody. I want to ask if, like, during your menstruation, when you're doing menstruation, there's this particular, like let's say tissue that used to come out, like a blood tissue. Is it normal? Like, what's the, oh, like, I don't know how to put it. Like, is it okay? Like, or is something you need to see a doctor for?
Okay, thank you, Abigail, for that question. Some of the tissue that you might be seeing, during your period is probably a blood clot, and it's normal. It's the blood, but it's clotted. But if you are seeing too much of it, that might be signs that you're having a very heavy flow, and you should see a doctor.
Um, okay, thank you very much, Dr. Taiwo. So, Enoch will be asking the next question. I see that he has been raising his hand. So, and please, every other person can put their hands down. That's just the last question for those that will be able to ask their question verbally. Enoch, please go on and ask your question, or we'll give somebody else your slot.
Okay, good evening, everyone. And my concern is like that. My private part is just scratching me, and I don't know what is the solution now. If you can get the answer, please, can you people help me with?
Okay. Thank you, Enoch, for that question. So yeah, like I earlier said, it depends on how long you've been having the itching for. So if you've been having it for if it has been persistent, then there is signs of an underlying issue, and you should definitely come and see a doctor. It might be fungal infection, it might be scabies, it might be an STI. You should see a doctor so we can investigate, you can get tested, and then you can treat it. That's if it has been persistent, like you said.
Okay, thank you very much, Dr. Taiwo. So I'll read out the remaining three questions. The first one here is, what is the cause of bleeding from the penis? I think that's what you answered. That's the first question. Dr. Taiwo, can you hear me? Sorry, Dr. Taiwo, can you hear me?
Okay, I can hear you now. Sorry, I can hear you.
The question is, what is the cause of bleeding from the penis?
Okay, so it depends on the type of what the person means by bleeding. So is it that just blood is coming out? Is the person seeing blood mixed with their urine, or is the person just seeing if their urine reddish? You understand? So it depends. So there are a multitude of things. It might be an injury inside the penis that is causing that. It might be a sexually transmitted infection. It might be an extreme urinary tract infection that causes that. It might also be even any there are a myriad of issues. It might be a bladder issue. So the person should definitely come in and get tested. If it's blood in urine or blood coming out of your penis is a serious issue that you should not ignore. It's a serious issue
So
that you
Dr.
should not
Taiwo, the person just answered you by saying the blood comes out after urinating.
the blood. Hello?
Can you hear me?
Yes.
Okay, so the person just, while you were asking, the person said the blood comes out after urinating.
Okay, so if the blood comes out after urinating, it might mean that the person has a urinary tract infection or even an injury in the urinary tract. So the person should get tested. The person should come and see a doctor and get tested.
And okay, so you can, if you are asking this question, so if it's you that is affected, you can book an appointment with BetaCare and get them to test you, and they can also treat you as well. So the second question is, how can I get rid of the bumps after shaving? So I think this applies to both genders.
Okay, it depends. It depends on how long it has been. Usually, they might clear off on their own. They might clear off on their own. But if the bumps is persistent, maybe let's say more than a week, then there are some over-the-counter creams that you can use to clear them. Sometimes just keeping the area clean and just doing like a warm compress can help you to clear those bumps, because it can open up the pores and it will clear. So, but if you're having bumps and it refuses to go, let's say like 2 weeks, 3 weeks, 4 weeks, then that you need medical attention. You need to see a doctor so that they can see it. It might be becoming infected. You might need to use antibiotics, but don't go and use on your own. You have to, the doctor has to see it and then prescribe solutions for you.
Okay, so the last question is, please, how does open source look like, and is it at the top of the vulva?
Okay, so open source just, it looks like a kind of a wound, like there's an opening in your skin, and sometimes something might be coming out, blood can come out, just clear liquid can be coming out. So if you have, yes, it can be in your pubic area, it can be in your on your vulva, it can be anywhere. So if you have open sore, it might be signs of a sexually transmitted infection. It might be herpes, it might be other things like syphilis. So you need to get that checked. You need to get tested.
Um, okay, thank you very much, Dr. Taiwo. And so, since you guys have asked Dr. Taiwo your questions and he has answered few of them, we will also be doing a giveaway for this section as well. We will also ask you questions, and just like we did the first time with Dr. Ogooluwa, once he asks his question, the fastest finger, the first four people to get the answer correctly. So first, it's three questions. Sorry, it's three questions this time, not four questions. And the first two people to get the answer correctly get a free consultation with BetaCare, and the third person, that's the last person to answer the question correctly, that's fastest finger, gets a free lab test bundle. So Dr. Tai will be answering these questions. If you know the answer, drop it fast on the comment box and add your WhatsApp number to it so we can actually reach out to you with your gifts. Thank you.
Okay, so the first question is I said this. What is shaving against the grain? What do we mean by shaving against the grain? So that's the first question. So if you know, just type it in the chat box and add your number. Okay, let's see. All the fastest fingers are not getting it. Oh. Okay, I think the first person to get it is Bethel, but it's like she has won before.
Yeah, she has already won before, so someone else has to be fast about it.
Okay, I think the second person is Esther. Esther did not
Okay.
put her number.
Okay, so since it's extra, I'm sure she'll drop an. Okay.
Okay, so
It's us and Lydia. The person
okay, let's
after
not,
Betel.
okay, it's
Yes. So
Asa and
please,
Lydia.
us and
Please
Lydia,
drop
drop
your
your
number,
WhatsApp
Lydia.
number. Yes.
Okay, so
Us and-
the second question is how does doubting cause yeast infection? How does vaginal doubting cause yeast infection?
Hmm.
Okay, we have a winner. It's Deborah.
Okay.
Deborah did not put her phone number. So Deborah,
I
please
think
drop your
I
phone
think
number.
make sure that if you're dropping your answers, drop your phone number. So I think the second winner is Deborah. She'll drop her
Okay,
phone
so
number.
yes, this is the last one. This is the one for the person that will win the free lab test bundle.
Yes.
Um, okay. So what causes cauliflower-like growth in the genital area? I know I said cauliflower. So if you were listening, I mentioned the eye that causes cauliflower-like growth in the genital area. So what causes that? No, no, no. We don't have a winner yet. I said it's an STI that causes cauliflower-like growth in the genital area. You people don't want to win my free last test.
Ah,
We don't have a
seems like
winner yet. Wow.
so Dr. Taiwo, will you just give another question and maybe end up giving the answer?
A
Seems
simpler question. Okay. So what's the name of the fungi that causes this infection?
like
This one is easy.
even me, I can answer this one, Sha. Maybe I will win itself. Who knows?
Okay, the first person to answer is although he didn't spell it well, is I think Rahab.
Rahab Abashi. Okay.
Yes.
Okay. Okay. So that's actually all for the three questions. Thank you very much, Dr. Taiwo. I'm sure since you're one of the team for better care, most of the students here that have any of the issues you've addressed so far will book an appointment with you. And we hope that when they book an appointment with you, you'll be able to break things down for them and get them treated. Thank you very much. Um, Next slide. Okay. Okay, so the beginning of this webinar, we actually introduced you to Dr. Amaka, and now she will also be addressing you on something. So please stay attentive. We are almost done with this webinar. So if you can stay from the beginning to end, this is just little out of your time. So she'll be fast about it. Thank you.
Hi everyone. Hi everyone. So once again, I'm here again. I just want to, I've seen a lot of questions, you guys asking, how do we book an appointment? How do we get to talk to the doctors? So I'm here to just tell you the steps to take. So as you've seen, we've been circulating it on our chat box, and it will also still be sent on the group chat. So you type in betacare.ng on your browser. Once you type in betacare.ng on your browser, just as you would do with any regular platform, you would actually just need to sign up. You can see on the images the steps that you need to take. So when you sign up as a patient, you fill in your name, your email address, your phone number, and tick that you are a student. So we know that you're coming from this webinar. And then once you click on that and you'll get a verification mail, you verify your account. Please remember to verify your account when you get an email from us. Click on the link and verify your account. Once you click on that link, you can now log in on our platform. And when you log in on our platform, first thing you should do as a student is you should go to your dashboard and select student verification, where you're going to select and send us some few documents that we need to verify that you're a student. Why do you need to do this? We have a lot of discounted prices for students on our platform. So if you select that you're a student, you would actually have access to those discounts. So select you're a student, fill in the necessary details when you're going to be graduating, and you would get an email as soon as you get verified. Then after you've gotten verified, you can go ahead and access all our services on our platform, talking to a doctor, reading our health articles, getting lab tests done, getting your drugs delivered to you at your doorstep, everything all in one package. And over time, we're also going to bring BetaCare to you in an app as well that you can easily access, just as you would access WhatsApp, Twitter, Snapchat, and other apps. Thank you.
Um, Okay, thank you very much, Dr. Amaka. Thank you so much. And just like she has given you a guide on how to book a section, for every one of you that attended this webinar or registered for this webinar, for this for 72 hours, you'll be having a 5% off to all anything you want to book, test or one-on-one consultation. You'll be getting a 5% off from the initial amount for 72 hours. And I've actually been able to talk to them so we can come up with something like a student plan, because it's not every time students who want to book an appointment or afford booking an appointment. And since BetaCare are here to help us, they are here to actually attend to us virtually. We don't have to stress. We don't have to start going to physical doctors and all. So I had to speak to them. We are all students. We don't have much. So there's going to be a student plan. It will be announced on the WhatsApp platform. So from that henceforth, the platform we used for publicity for this webinar will become a BetaCare platform for students. And when I mean students, I'm not saying it's necessary that you're in school. Even if you've graduated, even if you're just applying, even as long as you're a young adult that attended this webinar, you necessarily don't have to be a student in as much as it's going to be a student plan. So there will be a student plan probably before the end of this month, and it will be announced on the WhatsApp group. But for now, if you have any urgent need for consultation that you want to talk to a doctor, because this is a webinar, the doctors cannot break things down too much here because of time. But if you book a section with them, they'll break things down. They'll make you understand your body better. They'll make you know why you are having these recurring infections, why you are having this constant headache, why you are having insomnia, why you are getting nervous all the time. So please, I know this webinar is about sexual and reproductive health. That's not all BetaCare is all about. Yes, that's not what you can book them for. If you can book them for mental health, they even have tech services. So it's not necessary that you book BetaCare only when you are having infections. No, you can book BetaCare if you are having constant anxiety. So you see, constant anxiety, it's not like fear, it's not stress most times. Sometimes it's a sign that you are having a mental disorder. And if you don't speak to professionals, if you don't have a one-on-one section with people that know it better, so that you can get treated earlier before it gets serious, it's actually very bad. And I know we are students. Most of us don't have the time to start going to the hospital, stay on the queue, get a card, wait to see a doctor before you now. No. I know it's not all of us that can go through all of that stress. This student plan that is going to come out is going to be like a subscription. You pay every month. So at your own convenient time, there will be doctors always available to attend to you. You can call on the phone, you can chat, you can just be free with this doctor. And one thing about them is, see, I know sometimes why most of us don't go to physical hospitals is because we are shy. Telling someone your problem face to face is actually something like a shame, so that this person does not stigmatize you. Now, these doctors you'll be talking to, they don't know you, you don't know them, they don't even know, they don't care about where you're from. Their priority is what you're going through and how to get a solution for you. So it's like a private section. You can tell them anything and you get treated. So I will also drop this slide, this particular slide on the WhatsApp group chat. I will drop the platform link so you can register as a student for now till you are able to get a student plan. So thank you very much to everyone that attended this webinar. If you are a student, be it University of Abuja or not, just in case you don't know who to reach out to, especially on campus, anytime you are having any issue at all and you want a BetaCare service, you can reach out to me. My DM is always open. If you are a member of Ladies Talk Forum, you can reach out to any of the admins. They will reach out to me. I will find a way for you to book a section with these doctors. And if you even personally, anything you're going through, as long as you want a BetaCare service, just reach out to me. I will find a way to book a section with you. Thank you very much for attending this webinar. For the first set of people that came, your airtime or data will be sent to you. You will receive it, and I will also want you to acknowledge on the group chat that you've received it. You understand? So it doesn't look as if, okay, we just use it to sugarcoat you guys to come here. And I'll also drop the group link for the student platform. So I'll change the name this evening to BetaCare Students Platform. This is for young people like us. So for the first time, we'll have opportunity to actually talk about anything that's wrong with us. You just let me tell you, you're sometimes you go through things and you're not even able to tell your guardians. They are your parents, doesn't mean that you can open up to them. This is why Better Care is here. You, if they, and you're, it's not judgmental. Nobody will judge you. Nobody will say, oh, because you are having a fishy smell discharge, a doctor will start making you feel bad as if it's a bad thing. No, this doctor does not even know you. What their priority is just that solution. And sometimes if you're to get a test done, they partner with a lot of labs. Yes, so sometimes you can walk into these labs. You don't even have to talk to anybody. Just tell them you are from Better Care. You don't have to tell them the test you came for. It's nobody's business. That's how tight your privacy is with Better Care. You don't have to tell them what you are there for. You just go, they take your sample, and they will send your result to you online, like virtually, just like you've consulted them. They will also tell you how you'll be treated online. So thank you very much. I don't want to waste much of our time. So I think this is the end of the webinar. I'll also drop my number. I'll drop the customer care number of the Better Care. I'll also drop the group link. Please make sure you repost. Make sure that it gets to, and in fact, if you can fill up that group today, this is a wonderful opportunity. Not everybody will give you this chance. So if you can fill that group today, even if it's girl filled up, we'll open another one. Just make sure that you share this link, you add up your friends, add up your boyfriends, which I know you never agreed to anyways. Add your boyfriend, add your girlfriends, add anybody, so that we'll be helping you guys. Thank you very much. So have a good night's rest. Bye.
Hello, everyone. Good night. Thank you for your lesson. I'm very appreciative.
Hi, everyone. The webinar has ended, so you can leave. Thank you so much for joining. Good night.